narcissistic personality disorder, and schizoid personality disorder. Many years ago, I began the psychotherapy process 35 years ago. So that 25 years ago, I decided all patients must be recorded audio-video systems. Many approach I use these patients. Today, I look background these years, so that 3 patients I choose in my archive. One of them, narcissistic personality disorder, approximately 6 or 7 years duration, every week come to psychotherapy process. The other patients, borderline personality disorder, approximately 4 or 5 years duration, every week come to psychotherapist, mainly psychodynamic process. Third patients, schizoid personality disorder, approximately 5 or 6 year duration, time intercourse, but every week come regularly our session rooms. Then all these material I watched, and my participants watch these materials. These materials transcript professional transcriptor in home office, approximately 1,500 pages, all these materials. We look all these materials, and we look back how use different approach in this process: behavioral cognitive therapy, psychoeducational programs, Masterson approach, transference focused psychotherapy, emotion focused psychotherapy, relational psychotherapy. All of them, we use this duration. And so that I want to meet our institute, approximately 5 on 10 slides we watch together. Psychotherapist in Turkey, in Istanbul city, near Istanbul city. We construct 2005 years in Istanbul. Many years ago, approximately 35 years ago, I wrote different universities, especially psychotherapy, hypnotherapy, hypnosis professional. I want some paper from them so that they sent me all these materials. I published first book 1925 years. Some example from them. I wrote a different university library for paper. They sent all papers to my address from United States. First building our institute in Bayramoğlu, near Istanbul, and in the Bostancı. Last building in the Turkey, this is Peninsula in the Darıca city. These buildings, our institute, private institute, and entrance, training and lecture hall, training room, swimming pool, third year archive of patients' files. Approximately 4,000 patients include this archive, so that we choose only 3 patients from them. I mentioned these patients, one of them narcissistic personality disorder I mentioned, the other colleagues mentioned borderline schizoid personality disorder. I mentioned 1-2 minutes ago approximately transcript materials. You know, maybe look therapy history, different patients, approximately 100, from 100 to 1,400 to 500 pages include these material. 100 session and 400 session duration this process. I looked these books. Psychotherapy Institute Training Center in Beyoğlu, Istanbul City, Istiklal Street. First times I came to the United States in San Diego, International Hypnosis Congress, 1997. We construct James Masterson groups in the Manhattan, 2008 years. 1 year later, he died. Masterson group in Turkey, online from Mastersons. Anna Levinson, Jeffrey Magnavita, in Turkey, all of them. John Norcross, Alan Shore, John Clarkin, Cornell University Medical Faculty in White Plains, Otto Kernberg, Kay Herron, Otto Kernberg's wife, Frank Yamons, John Clarkin and Diana Diamond, my certification program, 2016 years old, approximately 6 year duration, every week supervision from Kay Herron, so that my exam, so that Diana Diamond, John Clarkin, okay, go pass. Otto Kernberg, first Congress, Trans-Focused Psychotherapy in Istanbul. Mahmut Volkan, the famous Turkish psychoanalyst in the United States. Paul Wachtel, you know all of them. We conflicts, Paul Wachtel with me, scientific complex, conflict. Alberto Post, Frank Dattilo, cognitive behavioral therapist. Leslie Greenback, emotion-focused psychotherapist. Our institute building near the seaside. Power supply. Power supply.
Okay.
Adapter, power supply adapter only.
No, for Mac.
We have Turkish style.
No. Well, European.
Is there any solve this problem? Okay. Dönüştürücü var Türkiye'den Amerika'ya. Çok iyi olur. William Prince of from Chicago and Western University Family Therapy. James Fossaki Psychology Motivational Systems. Joe Lichtenberg, Robert Stu, Frank Lahman, Aston Richard Cloud. Anna Stein, Dorothy Donna. Thank you very much for your attention. Second presentation for me, 1 minute, main presentation. Tahir Hoca bir olan mı? Who is client? The client was 18 years old, single, living with his parents and had a younger brother. One approximately 10 years ago. The clinical picture included intense anxiety, fragmentation, and occasional psychotic episodes. An initial psychiatric assessment excluded the differential diagnosis of schizophrenia, manic depressive psychosis, paranoid disorder, organic brain syndrome, and substance-induced psychotic episodes. What are the symptoms of client? It was concluded that the occasional psychotic manifestations were regressive and reactive symptoms that would be better understood from a psychodynamic perspective. The first step of the treatment was medication with antipsychotic and antiepileptic for mood regulation. And sedative drugs for a few months with ongoing weekly sessions. Mostly, mainly supportive sessions. After the psychotic symptoms were contained, attack therapy and psychotherapy was recommended. I mentioned about attack therapy now. What is the attack therapy? Attack therapy is an intensive and insight-oriented psychodynamic psychotherapy comprised of 40 sessions in a period of 2 weeks. We construct in the Turkey attack therapy special. My PhD thesis about attack therapy. The client spends the entire day at the premises. A usual day of attack therapy consists of one morning session and one afternoon session, and sometimes of block sessions. The sessions begin with detailed history, including the family tree, as much as possible. My daughters, please tell me any pronunciation wrong, okay? All times I am waiting you.
Okay.
Then one words, it is wrong presentation, which is?
Premises.
Thank you. The aim of taking every detailed life history is to address each significant memory and help the patient reorganize their inner world and gain new perspectives. What is attack therapy tool? Intense history taking of 10 or 12 sessions is followed by psychoeducations of nearly 10 hours, mainly on the working principle of the psychic apparatus, developmental stages, and treatment techniques. The goal is to help the client achieve insight regarding his previously told detailed life history with the awareness of well-known principles of the psychic apparatus and psychodynamic rules. It is followed by distinguishing the healthy and pathological aspects of the client, highlighting the egosyntonic and egodystonic features and psychotherapeutic treatment methods to be applied. It is important to develop cooperation with the client. Planning the treatment program together engage the client with a sense of responsibility. The patient should gain awareness of their pathological egosyntonic parts and healthy egodystonic parts so that they can have an idea of the direction of and nature of course of therapy. Cognitive behavioral, psychodynamic, and extensional techniques are elaborated as much as needed for the particular patient. This issue contextual and subjective area for me. How was attack therapy used for this client? The client in question was taken to this intensive program for nearly 30 days to listen to his detailed life story, give psychoeducation, elaborate on the treatment techniques and strategies, and begin the treatment. By the end of attack therapy, the client had recovered from the psychotic symptoms, had his anxiety partly relieved, and was willing to and eager to begin treatment with the understanding that his symptoms were transient features and of the long-term nature of working in his personal organization. According to psychodynamic formulation, the patient has severe narcissistic personality disorder, occasionally adopting defenses typical of other personal disorders. The long-term treatment of the severe narcissistic personal disorder began with weekly sessions, exploring the ways to promote his insight and awareness and containment of his aggression. In retrospect, the early phase of treatment was mostly carried out in the form of relational psychoanalytic psychotherapy. Look today. Ruptures in the therapeutic relationship were identified and repaired in the session. This rupture repair process gradually improved the patient's capacity for self-soothing, affect regulation, introspection, and mentalization. 2 years of relational, insight-oriented psychoanalytic psychotherapy proved to be very helpful as the patient moved forward to enhance productivity, intimacy, and socialization. What are the manifestations of severe personal disorder? As part of the manifestations that led to the diagnosis of severe personal disorder, the patient had intense aggression that was often directed to others, was involved in gang-like organization as a black belt kickboxer, and used physical violence towards gang members and or police forces at times. He also engaged in sexual harassment and violence, often in the form of touching, groping, or cornering women found alone in the street. These acting out behaviors escalated when the patient experienced self-fragmentation and intense anxiety. In terms of object relations, the case formulation centered around a dominant split mechanism where the aggressive unit was very active. In a parallel quotidian formulation, when the self-object function failed, the patient was acting out to prevent disintegration or deal with the aggression in the split in a clearly sexualized way. Relying on the strong therapeutic alliance, aggression was worked through to help the patient understand the sexualization of the aggression resulting from the vertical split. This is avoidable, you know, from code, at times of failure of the self-object function. The patient's self-soothing attempts included watching pornography, including heterosexual, sadomasochistic, and all sorts of perversions and exhibiting transvestic behaviors, incestuous wishes and desires, transsexual tones, and homosexual fantasies. Main issue for this client, dropout. The treatment was interrupted at times, but the patient came back to therapy after a few months of break. Therapeutic alliance appeared to have been sustained in those periods. The patient returned when feeling helpless and desperate. It was understood that they experienced the therapist both as a container in the Bayesian sense and as a self-object to meet his primary and secondary mirroring needs and a libidinal shelter against the aggressive unit. How to solve the dropout issue? These interruptions were addressed in a containing, supporting, validating, and mirroring way by the therapist, and after that, the therapist moved to a more neutral position in a renewed framework based on a renewed therapeutic context. It is very important slide, this slide. This is crucial. Supportive psychotherapist, neutral psychotherapy, psychoanalytic psychotherapy position. It is necessary, this patient, for dropout. These interruptions were addressed in the containing, supporting, validation, and mirroring way by the therapist. And after that, the therapist moved to a more neutral position in a renewed framework based on a renewed therapeutic contract. Because why important this slide? You know exactly hardly border different approach, psychotherapy approach, and the other sides, behavioral cognitive therapy, dynamic psychotherapy, supportive psychotherapy. Psychotherapy exactly said us, please, full, hard, neutral position. But it's not possible this position. If we decide to neutral position, that's times these patients drop out all these duration. The third year of therapy included the Masterson approach toward the narcissistic personality disorder. Therapist's neutral position allowed the patient to talk about his rage in the session and experience and tolerate his ambivalent feelings towards the therapist by use of confrontation and especially mirroring interpretation of narcissistic vulnerability. This sentence, very technical sentence from Masterson approach for narcissistic personality disorders in the context of transference, counter-transference. Patients' intense anxiety and experience of injury in social life sometimes turned out into a great rage and murder fantasies against the therapist. In one session, he brought a knife to the session intended to kill the therapist, who only found out about his intention and the level of his aggression in a later session. This process allowed the patients to expand his insight, tolerance, and affect regulation capacities. He became more involved in social life, started working at his father's shop, could sustain his job and relationship with customers. Becoming more calm and balanced, his previously aggressive relationships with women containing sadomasochistic fantasies, and sometimes psychotic episodes, became more calm and balanced. He attempted to form friendships with women and initially had some brief relationships that lasted for a few months, leading to ruptures and intense aggression. Repairing to ruptures in the session, the 50 years of treatment with narcissism included suspending neutrality when needed to perform the self-object function in a containing, affirming manner, and repairing to ruptures in the session, and resuming neutrality to explain the reasons for this attitude afterwards. The patients gradually became able to sustain intimate relationships, work regularly and efficiently at his job, take over the family business, establish social relationships, take masochistic and perverted sexual behaviors under control, conceive of more normal emotional romantic relationships, feel love and experience love with the opposite sex. To a neurotic level of triangular relationships, in these 6 years of treatment, the patient proceeded to a neurotic level of triangular relationships. There were times when he regressed in response to this competition, and those when he could tolerate it. He had a girlfriend and could establish an intimate relationship. In the last phase of treatment, the patient was supported to deal with occasional social anxieties, panic attacks, and partial depression accompanying the neurotic picture. He was successful and efficient in his work. He deepened the relationships with his girlfriend, and they got engaged to get married. The treatment was terminated in agreement with the patients following this last phase. Summary and conclusion. Kaç dakikam var?
22 dakika oldu.
Doldu. Okay, bir iki slide okuyayım ondan sonra. We don't have enough time, so that we must finish. In this respect, the supportive initial phase of therapy aided by pharmacotherapy was appropriate for the initial psychotic attacks. This initial phase of treatment was not limited to pharmacotherapy, but the patient was properly prepared for psychodynamic psychotherapy. We thought the usual term of attack therapy would be 10 to 15 days. This patient's attack therapy was extended over a period of 1 month in accordance with this particular internal process to allow for a more gradual and solid grounding of the insight and awareness of the egosyntonic and ego-dystonic aspects. The relational setting of the first 2 years provided the ideal setting for the patients to overcome regressive and paranoid states. If patients' need for spontaneous validation mirroring parental motives were met, and it helped suppress the sexual perversions, homicidal potential, and antisocial behaviors. If the Narsisistic approach of transference-focused psychotherapy was applied at this period, the technique of neutrality would probably cause the patient to drop out of treatment. Against the backdrop of his relationship with the therapist, the patient could explore and understand his inner world, aggressive feelings, and psychotic episodes as disintegration products. So he embraced the therapeutic process. If the containing, validating, mirroring approach was maintained as the sole technique, in later phases of therapy, it might cause the patient to stay dependent rather than achieve independence on progress. Therefore, the therapeutic framework was revised to shift Narsisistic approach that is based on the object relations theory and addresses to narcissistic disorders in a different light in terms of developmental psychology. The patient began to tolerate expressing, addressing, and containing the homicidal rage that he felt towards the therapist. The painful exploration of the aggressive feelings in the here and now helped the patient progress to a neurotic level, replacing the use of suppletive mechanism with repression. Thank you very much for attention. Second presentation, Nilüfer Demirhan. He mentioned about borderline personality disorder. Yeah.